In Dr. Ronny Jackson, retired Navy Rear Admiral, former physician for Presidents Obama, Bush, and Trump. Thought about you right away because you're a friend of the president, former doctor of the president. Now you're a political figure. You know how necessary it is to go out and about and get the name and get the word out about your candidacy. At the same time, take risks into account. So, what are your thoughts about the president, his condition, and what you know about what he's experiencing with the virus? So far, the symptoms are not profound.
Right. Yeah. What I know right now to be true is that he's asymptomatic right now. And I think that's great. I think that he's going to continue to be asymptomatic. I think we have to remember, that he's in great physical health. Otherwise, he doesn't have the comorbidities. Several of your guests have mentioned that, but that's true. And that's going to be big for him. And I think that, he's going to continue to move forward. And, most of the people his age, even in his category, the vast majority of them, they recover from this very quickly. Most of them don't even know they have it. And I suspect if the president weren't getting routinely tested, and if Hope Hicks hadn't tested positive, and that prompted him to be tested, he may have moved on and not even known he had this. Sure. He's get tested every day. So, but under other circumstances. So.
Yeah. At this point, we don't know where the president got it. We don't know if it's related to Hope Hicks. But you've been around the White House during the pandemic. Do you feel that the White House protocols have been, stringent enough to protect the president? And at the same time, do you feel that the protocols out on the campaign trail with the rallies where he is a distance from people, but invariably people get up closer to them, have those protocols been safe enough to protect the president and the people around him?
Well, absolutely. I believe they do everything they can to keep him safe, certainly at the White House. And, I continue to go up there pretty frequently. The testing at the White House is aggressive. And that's part of the reason that this gets picked up so quickly. And I suspect that this got picked up very quickly in the course of this illness for the president because of the aggressive testing there. But, the president, he's led by example, and part of leading by example is he's had to get out and he's had to interact with folks. He's had to continue being president. And he hasn't been boxed up or, cooped up in the White House and campaigning from within the White House. And I think that, that's been necessary. So I think they're doing everything they can to keep the president safe. And I think they've been doing a good job doing that.
So there are some Democratic leaders that are saying the vice president should not debate Donald Trump again. The next debate is on October 15th. He said he tested positive yesterday, which was October 1st. So if he continues not to see any signs to be asymptomatic, will he be good to go on October 15th?
Absolutely. That's plenty of time. And I mean, he's going to be ready to go before that, quite honestly. People are talking about the 10-day quarantine. The 10-day quarantine, for the most part, is for people that get exposed to it but don't have any symptoms and don't, and we don't know that they're positive. We know that the president's positive. So they'll keep him in relative quarantine at the White House. They'll continue to test him every day. But once he has 2 negative tests, that are 24 hours apart, he should be good to go back at that point and go back to normal. So
after the 10 days?
Even before the 10 days. Okay. Yeah, even before the 10 days, because we know he's positive. So once he tests negative twice, he should be safe to go back to his normal routine. And that'll be well before the next debate.
And by the way, Dr. Jackson, wouldn't you also say he'd have the antibodies to make him safer for the final sprint, maybe to the end for the last 15 days? When you get it, it leaves you with the antibodies, correct?
Sure. Yeah, I mean, almost any infection that you get will produce some type of, transient, if not permanent, depending on we don't know exactly how this is going to play out with coronavirus, but some sort of immunity that will last for a period of time, but certainly, well past, the debate.
And sure. Dr. Jackson, I just add one thing. Dr. Ahmed was on short time ago. She's at NYU Langone treating patients on a daily basis with this. She said, being that he's the president, I would probably hit him with remdesivir and maybe some plasma because of the nature of his position. Would you back that up?
I'm not going to argue with her. She's a very intelligent lady. She's at NYU. She's a pulmonologist. So I won't argue with the fact that could be a reasonable course. I will tell you that I don't think that'll happen with him. I don't think they'll pull the trigger on that as long as he's asymptomatic. That would be something that the threshold would be low for once he became symptomatic, though. So I don't think that's going to happen right away.
Right. Why, could I ask one more thing? Why? Would there be risks if he took that?
Right. I mean, there's risk to everything. And so, as a White House physician, we always try to make sure that we're not treating the physician differently than we would other patients, because sometimes you can overdo it and you can injure the patient in the course. Sure. So especially with remdesivir, it's an IV medication. You're going to have to give that to him every day. I just think that the threshold would be low if he got symptoms. They would do that quickly, I think, but I don't think they would do it while he's asymptomatic.
Right. For anybody who's just waking up, the news breaking overnight, late yesterday, it was discovered that Hope Hicks, his communications director, tested positively. Then the First Lady and the President were treated. They're both positive. And now we're talking to the former White House physician, Ronny Jackson. Ronny, it was back in the spring, famously, the president started taking hydroxychloroquine after a valet who was there in the personal residence had been around them and had not been wearing a mask. Hindsight's always 20/20. Should he have been continued a course of hydroxychloroquine right up until today?
No, not at all. I mean, he was taking it prophylactically, and the prophylactic dose is only for a short period of time, 7 to 10 days. So he did that. He took a full prophylactic course, and that was the right thing to do at the time. I do think, we were talking about the remdesivir. I do think that it's possible that they go ahead and they reinstitute the hydroxychloroquine and maybe the zinc and or the azithromycin and maybe even inhaled steroids. Those are some medications that have very few side effects, and it's possible that they would do those at this early point. And we already know, because he's had the hydroxychloroquine before, that he's probably not going to have any type of negative reaction to that. So we've already kind of tested it during it. So I think that's something they can feel comfortable with.
And don't they say the sooner you start taking that, the better the results?
Yes, that's what some of the studies to date have shown.
Okay. Dr. Jackson, thanks for being with us.
You bet. Thank you, guys.
You're welcome. Todd Pyro joined